It's 6 months that can make a major difference for a newborn. That's how long it's recommended that women breastfeed after giving birth. There are immediate and long-term benefits for babies when moms make that choice, but it's not just good for baby. There are benefits for mothers, too. Once again, here's Lorene Cachola.
2.5-year-old Elena and 1-year-old Annie are off to a good start in life. They're stopping by All Better Pediatrics to see their doctor. Their mom, Katrina Shook, made sure that both girls were breastfed. For Shook, the decision was an easy one.
Once I got pregnant and started reading a lot of books and learning a lot more about it, I realized how great it really was for my child. Then it was sort of a no-brainer, and I just sort of got it in my mind that I was going to do it no matter what.
Experts say there's a long list of benefits from breast milk. Breast milk lowers babies' risks of a number of health problems. That can mean fewer ear infections, less chance of developing diabetes or obesity later in life, and a reduced risk of asthma. Julie Ware, who chairs the Shelby County Breastfeeding Coalition, recommends breastfeeding to mothers-to-be because its powerful protections begin almost immediately.
The baby benefits from the first milk they get from their mother. The colostrum is full of infection-fighting properties, and it is in fact the baby's first immunization. So it's extremely important that the babies get that.
The benefits from breastfeeding aren't only good things for the children being breastfed. Mothers also enjoy a number of health benefits. Women who breastfeed also have lower risks for breast and ovarian cancer. Breastfeeding can reduce the risk of type 2 diabetes and other obesity-related problems for women. Shanitha Ship found another benefit after her daughter, Ariana, was born. It also helps women lose the weight gained while they're pregnant.
The biggest benefit for me health-wise was they talk about how the uterus is able to shrink your tummy back into shape after you have a baby. And this time, like I said, more so than the last time, and maybe because I'm nursing longer than I did, but the weight just dropped off drastically.
The rates of mothers who breastfeed in Tennessee and Shelby County are well below the national average. Dr. Ware says breastfeeding could be part of the solution to this area's public health problem of infant mortality, because the antibodies in mother's milk can be a big help to premature babies. It's recommended that moms breastfeed exclusively, that's not using formula at all, for at least 3 months after a baby is born, although the American Academy of Pediatrics says that 6 months of breastfeeding is best. And when moms can, they should try to mix breastfeeding and other foods for at least a year. But some moms don't breastfeed because it's painful, or they worry about breastfeeding in public or at work.
What a lot of people don't know is that Tennessee has a law protecting a mother's right to express her milk for her baby while she's at work. That law also provides that she be able to do so in a clean environment, like not sent to the bathroom, which some moms are.
Here's another benefit to breastfeeding instead of using formula. It saves money. Depending on the type of formula, a family could save anywhere from $1,100 to nearly $4,000 per year. Plus, it cuts down on trips to doctor's offices, and breastfeeding mothers miss less work. And nothing beats the contact a mother shares with her baby during breastfeeding. It helps cement an emotional bond that can actually improve a baby's brain development. For Smart Medicine, I'm Lorene Cachola.